have another installment of an Eviva webinar with real weight loss surgery patient Mel. Mel, thank you for joining us, and Dr. Tan, the other weight loss surgery surgeon that is here at Eviva. And Mel, it's a real honor that you're here, and we're very thankful. And I can confirm that we are now live because I just heard myself on YouTube. So let's mute that. So. All right, we are live. So if you have questions or thoughts, in the comments, please leave them, and we'll try to get to them as well as we can. And yeah, so as we get into it, Mel, can you tell us a little bit about yourself? Like, how long were you thinking about weight loss surgery before you finally pulled the trigger, and what was it that made you be like, now is the time?
Sure. Yeah. I was thinking about it for a little while only because I had weight problems my entire life. I got diagnosed with PCOS, which is polycystic ovarian syndrome, when I was 22. And that caused insulin resistance, which led to having a hard time losing weight, regardless of what I did. Did all the fad diets, did all the crazy exercise. I only really lost any significant amount of weight when I restricted my diet to 600 calories and was jogging 3 miles a day. And of course, that's not sustainable, right? So, I tried GLP-1s when they came around, and I tried that for a year, and it didn't have much effect on me. I actually only ended up losing about 15 pounds, and decided that I really need to do something. Like, nothing that I was doing was working. Nothing that I was doing was going to be sustainable. So I really looked into weight loss surgery. I found Eviva, by Google search, surprisingly, and came very highly recommended. And it wasn't until I talked to you, Doc, that it really sold me on doing it. So
yeah, and look at you now. So
yes.
90 plus pounds, near closing out on that 100-pound mark, which is fantastic. I hope you're really proud
Very
of
good.
yourself. Yeah.
Very, yes,
Yeah.
very. I'm not gonna lie, it wasn't easy. It was a journey. It's been a journey. It probably still will be for the rest of my life, but I can't say that I regret any minute of it. I would do it all over again.
Mm-hmm.
I muted myself. I
Oh,
shouldn't have even done that. I was
yeah.
asking
Your turn, Dr.
Mel,
Tan, for the question.
Mel, when did you have surgery and what surgery did you have?
I had surgery on March 3rd of 2025, and I had the VSG surgery.
Yeah. Nice.
Yes. Yep.
I think this is the question of the day, which is there are millions of people that are exactly in your situation, which is I tried the medications, I lost a little bit of weight, but it didn't solve all my problems, and I really didn't make nearly as much progress as I needed to make. How has surgery been different from medication when you had a normal stomach?
I Because my stomach's smaller, I'm restricted in the amount that I can eat at any one given time. That does not to say that I couldn't potentially eat, a tiny half a bag of chips, in 1 minute, and then 30 minutes later eat the rest of the bag, and then 30 minutes later eat half a candy bar. It's not to say I can't do that, but as long as I make the right choices for the right foods, the surgery helped shrink my stomach so I can only eat a little bit at a time, but I get to eat all throughout the day, so I constantly feel full always. And if you're making the right choices with the right foods, then you're always feeling full in the right way. So you're not getting those constant crashes where you're constantly feeling hungry, that vicious cycle. So,
Yeah.
but that was good because the the GLP-1, it curbed the hunger, but it didn't really do much more than that.
Yeah. Yeah, it is a really interesting comparison between the two. I liken it
Yeah.
to, having a procedure on your intestines, like your stomach and your small bowel, is a hardware upgrade, and it is
Yes.
noticeable how different hardware is always going to be a limitation compared to software. And the medications are a great software upgrade for some people. Like that's what they needed, and it gets them on the right track. But truthfully, like your hardware is made to survive hardship and scarcity, and you are always going to be working against that piece. So
Yeah. 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 We had talked about after I had the surgery, I had moments where, even though I was physically full, my brain was trying to tell me I'm still hungry, right? Which is where we had discussed microdosing the GLP-1s. So having a combination of the two actually has been pretty perfect for me. I'm not saying that's perfect for everyone, but it's been perfect for me because not only do I have that physical restriction, but now the microdosing of the GLP-1s has helped my brain kick in going, no, you are full. You don't need to keep eating. Even though I couldn't physically eat, my brain wanted me to tell me that I needed to keep eating. And so having a combination of the two was actually perfect for me anyway. So yeah, it's worked really well.
I truthfully, if I could do that, if I could convince everyone to have the standard pathway be smaller stomach plus a little bit of GLP-1, I think that's the future. I really do. It's
Yeah,
similar
it's
to the way, like, if God forbid somebody gets cancer, most cancer treatments are surgery and then a little bit like and then chemotherapy.
right,
Like, and you
targeted.
want to use them together because they work so much better together than either of them works alone. But
Yeah.
to get the best result for the most amount of people, you really got to do both. You really got to do both. So
Yeah, it's made a huge difference. It to me, for me anyway, it really has. I think it helped just, honestly, I think together, just my quality of life has been better. When you are constantly in hunger mode all the time, your quality of life really suffers from that. Because that's all you're thinking about all the time. It's been nice to not, have those intruding thoughts all day. And I mean, I don't even give it a second thought anymore. And it's been great. But yeah, I'd say the surgery was 100% what I needed for myself. And I would do it all over again for sure.
Dr. Tan, you use a lot of medication too with people that have smaller stomachs. Do you notice, like, and normal stomachs, do you notice too, like, there's a pretty big difference in the amount of dose that you need to be effective with the stomach people, normal stomach versus small stomach people?
Yeah, I mean, now I think, like Mel, your story is what we see very commonly now, which is folks have tried these GLP-1s and they help. Most people find the GLP-1s helpful. They help curb your appetite a little bit, decrease your hunger a little bit, but maybe it's not the full and most robust tool that they need to lose weight. The thing about weight loss is it's not one size fit all. So oftentimes we have to figure out what works best for each person. But that said, after surgery, if we are to continue the GLP-1s, which some people want to, some people don't, I drop them down to the lowest dosing. And we usually stay there for a while before we even have to do a dose increase. And so microdosing means a lot of different things to different people, but I'm usually putting everyone down to that lowest dosing and staying there again for a couple months at a time. So, yeah.
Mel, were you afraid of your stomach getting permanently smaller with weight loss surgery? And if so, like, what has it actually been like?
Um, I mean, I think I was just scared of surgery overall. We had talked about that. I mean, it's I don't want to say it's routine surgery. It's not technically routine, but it's done so often that it's almost routine to you guys, but to us, it's major, right? In my head, I'm thinking this is a major surgery, anything could happen, anything could go wrong, blah 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 blah. And so of course that was scary as far as the stomach being smaller. I was concerned about how that was going to work. I was wondering, is this going to mess up my body permanently? Is this going to change the way that I have to eat? Am I going to have to, be on liquid diet for the rest of my life, because it's so small.
Yeah.
Like those crazy thoughts, went through my head. And so, but realistically, no, once you get past like the initial post-surgery diet, which is just for, health reasons, I'm back to just regular diet, but obviously, making protein my priority. But I am eating regular things, like chicken and broccoli and things like that. So although I can't eat as much, I still can enjoy the things that I like. So yeah, it's nice.
I honestly got that exact question today of someone asking like, well, am I gonna have to have a liquid diet for like a year or something or more after surgery? And I was like, no, no, that's
Yeah.
just a week, maybe 10 days. Yeah.
Well,
I
Mel, you're
see.
totally right, though. Uh, yeah, Mel, you're right in that this is not routine for you. It's very routine for Dr. VanderWel and I, and we often forget um, some of the thoughts that kind of go through people's heads. And I would say it's not crazy at all to have the idea that you need to be on liquids if we remove 80% of your stomach, or there are going to be foods that you can't tolerate or can't eat long term afterwards. The reality is that that's not true for most folks, that you can tolerate pretty much everything. But um, not crazy at all.
Yeah.
I think that's very
Very,
logical, actually.
very normal, very common, very common. I think most people think
Yeah, I
that,
can
which is,
imagine probably a lot of people think that too. Like, oh, am I just gonna have to drink my foods the rest of my life? So, no, it's been great to know that I don't have to do that. You don't have to be on liquid diets for the rest of your life. You can actually eat normal foods, albeit smaller bites, smaller portion, but you can still enjoy the foods that you like. So
yeah.
you're not restricted in that sense. Yeah.
So speaking of, we do put you on a liquid diet for a little bit after surgery. What was that first month or so of recovery look like for you?
That was really rough for me, actually. I had actually texted Dr. VanderWel on his phone because I was really concerned. I was not getting enough calories, protein, water, anything. I couldn't really keep, all enough down. And so I was super lethargic where I couldn't even get out of bed. I struggled. I had to have help from my husband to even get to walk to the bathroom just because I didn't have any energy. And, we had talked about this. And so for me, I was burning fast. I mean, I think I was down in like the first 2 weeks, I was already down like almost 30 pounds. Like, I mean, it was burning
That's
fast. And you're
too
like,
fast.
okay,
But
yeah,
yeah,
that's what you said. You're like, hold on, this is too fast. Hold on, take one of these drinks, And so
yeah.
I took one of the drinks and it slowed that down. And once we got that regulated, it was so much better, so much better. I was able to start intaking the water I needed to take. I was able to drink those soups and keep those down. So once I was able to get out of that initial burn phase, I was able to take in the calories I needed to take to feel better. And then I was starting to slowly get back on the right track. So once you hit like the soft food stage, you feel so much better, when you're able to eat those super soft foods like, almost like runny eggs, or, even cottage cheese, chewing it super thoroughly, those little soft foods. Like once you hit that, you feel 100% better. I think getting past those first like 2 or 3 weeks is really a mental game. If you can push past that mentally, once you hit that food phase, you feel 100% better. Yeah.
Yeah, yeah, you had a little more rough course than normal. So, but that is why I think that's why I give people my cell phone because I just want them to know if this is not normal. Like you had a rougher case than most people do. So it's like, hey, okay,
Yeah.
there's things we can do for this. Here's try the you got on the naked protein juice, the naked protein smoothie protocol, and we just get your calories up, break it down a little bit smaller, take make a little bit of adjustments. We'll get you through. Yeah. So.
Yep, and it worked really well. Yeah, but it was nice. It was nice knowing that I could just text you and say, "Hey, I'm feeling some kind of way," and you were great about just literally text me right back to say, "Hey, let's jump on video. Let's figure this out. Let's take care of this." So yeah, it was great.
Yep. That's we've done a lot of this, so we know what's normal, and when it's a little bit not the way we want it, as smooth as going as we want it to do, we know how to get it back on track. So.
Yeah.
Have you had dumping syndrome since having your weight loss surgery?
I actually never had it. I've read stories about it in the group, the groups, the Facebook groups and the Reddit groups or whatnot, and people have talked about it, about, what it is and when it happens. But I was very, very fortunate to never have had that happen.
Yeah, dumping syndrome is actually it's pretty rare with sleeves unless you're like really getting off track with your diet, like really off track. It can happen, but no, it's not super common. Like bypasses are a little bit different story. Gastric bypass are a little different story, but yeah, I'm glad to hear you haven't had any. And it is interesting to hear like that is such a big fear that people have out there.
Oh, definitely 100%. Reading those stories, freak out, like when I would be at work, I would just think, I need to make sure that I eat 100% exactly what I need to eat because I can't have this happen at work, and so that's just the stories, yeah, I tend to freak you out a little bit,
Yeah.
but I was very grateful to not have to yeah, experience that. So.
Yeah, dumping syndrome is not fun. Some of my patients who have dumping, especially with like bypasses, they like dumping syndrome because it keeps them away from the foods that they're not supposed to eat, so to
Yeah.
speak. But it's definitely not a fun experience to have dumping. I would say. If you
I
can
did
avoid
not think
food.
about it that way.
Yeah,
Yeah.
but it's probably better just to not ever have dumping. It's not fun. Well, Mel, I'm curious. We you mentioned this briefly, and I kind of wanted to get more of your thoughts on it. You've been on the GLP-1s before surgery, and like I had mentioned before, a lot of my patients that are thinking about having surgery now have been on the GLP-1s, and something I've been seeing a little bit more now in comparing the two, like life with just GLP-1s or like life with surgery, is surgery gives you a little bit more consistency, I think. And weight loss is all about consistency, right? It's not about, well, this week I'm going to choose to just eat salads and eat healthy and exercise, and then the next week, do something else. And in surgery, it is a permanent change, which is a little scary for some folks, but it does create consistency for a lot of folks. Does that feel true to you, or how have you?
100%.
Yeah.
Really. Yeah. When I was on GLP-1, I was actually on the max dose. I was on the max dose for almost a year. And like I said, that created, a lot of, abdominal issues, abdominal pain. It didn't really do much as far as like restriction goes, but it made me a little less hungry. So it curbed the hunger a lot. But it didn't really, I think for me, it's more of like a mental game. So for me, it was like I didn't feel like I was restricted in any way, mentally, because you could still eat whatever you wanted to eat on, the GLP-1s. When I got the surgery, I felt physically restricted, which I think kind of helped me kick my brain into the right mode to get myself into the right nutritional diet that I need to be on, uh, because I couldn't eat all of that junk, because when you have the surgery and your stomach's restricted, you can only intake so much if your body needs like certain things, right? So if you eat and you start out by eating your protein, which is the thing that you need to prioritize, you realize that by the time you're done with that protein, you may have a little bit of room left, but probably not too much, which is almost great because now you've intaken the thing that you need to intake and you don't have any room left for all of that other junk. So I think physically, having that restriction was a lot better than being on that in that GLP-1. You know, for me anyway, I think that it helped me mentally on that level as well from having that physical restriction. Even being on, like I said, the max dose, it didn't do that for me. Being on the micro dose is more for me just a way, and we only needed the micro dose after the surgery, which is really odd because before I needed the max dose to get the same effect that I'm getting from the micro dose after the surgery, and that was just to curb the hunger. So that's interesting that I only needed the micro dose this time.
Yeah, it's really interesting how changing your intestinal tract, like your GI tract and your stomach, making some modifications there and getting that upgrade, it does really affect the biology a lot
Yeah.
in very profound ways. And like almost every single one of them are beneficial for this journey. So, which is cool.
Yes.
It's super cool. I think I don't know, Dr. Tan, you and I say this all the time. Like being a bariatric surgeon is one of the most, I think, the most fascinating and one of the coolest things about medicine because you see how science and your body's relationship with, something as critical to it as food is so biologically driven, and you can find something that can make a positive change that absolutely changes people's lives, and it's a really cool thing to be a part of. So,
Humbling as well, I would say. Given how often we do this, we actually know very little in terms of how
very
bariatric
true.
surgery actually works. So we're often surprised, and usually pleasantly. So
Yeah,
that's good.
it is. We don't really know why is it all of a sudden that after surgery you're like, hey, 600 calories. That's totally fine right now. I'm good with this for like another good 6 weeks. We're good. Oh, I remember. I got some energy stored back here in the storage tank. I'm just gonna go start getting that stuff out of the storage now. So it's wild. Yeah, it's very wild.
Yeah. And it's funny how everybody's journey is completely different. Yeah, there's some things that we have in common, in our support groups, but everybody's journey is so different. Their backgrounds, their medical history, it's all so completely different. And so the journey that you take after surgery, it becomes different as well. But there are some things obviously that we all have in common that we get to share. But I will say that I would 100% recommend that if you're going to have this surgery, definitely jump into those support groups. They're so helpful.
How has weight loss surgery affected your social relationships? Since so many social interactions revolve around food.
Um, I'll tell you a funny story. So I went to my female doctor, and I only have to see him once a year. So I went and saw him a few weeks ago, and I don't think that he recognized me because he talked to me as if he'd never met me before. And it wasn't until we had got talking about the things that we talked about last time I was there that I think the kind of light bulb clicked on, and he realized that it was me. And so then we started talking about the weight loss, and he was actually really excited for me, and just to discuss it and things like that. So it was funny. I was like, wow, I never thought that, like, a year would go by and somebody would just not even recognize who I was, even though I've been going to him for over 10 years. So that's funny to me. So but socially, sadly, we live in a world where, everybody wants to judge a book by its cover right off the bat. So I will say that as much as I hate to say it, losing weight helps you on a social level, only because people really do treat you differently. And as much as I wish that weren't true, I am happy, I guess, because obviously, you want people to treat you kind and nice, and give you the benefit of the doubt and things like that. And and I just try to be nice to everybody, but unfortunately, it's not the world we live in. So, like, I will say that I get treated a lot kinder and with a lot more grace now, after the surgery.
Yeah. Very common story. You know, most people have a period where they're like, they get kind of, angry about it, that they realize how much nicer people treat them
Yeah,
now that they've lost weight. So,
it really, really does happen. But then
It's
I
a hard
think
one.
that's a good thing for you, because then you get to be kind to those people that are in your situation where you started. And so you get to spread that kindness to others that maybe need it as well. So
yeah.
it's a good thing. Empathy.
That's a great way to look at it. There's a lot that you can't control in the world around you,
Yes.
unfortunately. So, how has eating changed with your family or friends when you eat out or at home?
That's actually been great, because my husband has been my number one supporter. He is my number one fan, and he has gone to doing most of the cooking, and he always cooks clean. And when he prepares my food, and me and Dr. VanderWel was talking about this, we went and we threw out all of our big dinner plates, right? And we went and replaced them with all of salad plates. And so now when he feeds me, or well, I don't want to say when he feeds me, but when he makes our plates, he always says, "Is this enough? Is this enough?" And he always starts out really small, and then he'll put a little bit bigger, a little bit bigger, just to make sure that, okay, this is enough. Is this enough for you? Is this enough for you? So he's been absolutely wonderful about that. Yeah. Yeah.
Wow.
Yeah.
I would say that's an added bonus.
A
If
plus
if the
husband
weight
mode.
loss and
Yeah.
the health, husband now cooks every day.
Yes. Yeah. It's been fantastic. Yeah. He's
That's
so
the biggest
excited.
sell.
He's constantly saying, "I'm so proud of you, I'm so proud of you, I'm so proud of you,"
Aw.
because he realized he goes to the gym with me. Well, we have a home gym, but he goes into the home gym with me, and he does his workouts with me, and he goes on walks with me, and he just is always saying, like, because when we first started out, I couldn't walk to the stop sign without, my knees hurting, without breathing hard, and now we can walk around the entire neighborhood, and he's always saying, like, "Gosh, I can't believe, just last year you couldn't even make it the stop sign. Look at us now," and he's just like, and he's beaming about it. And he's so happy about it. So I am very, very grateful to have someone in my corner like that.
That's super cool. That's what it's about right there. That's what it's about. Yeah.
Yeah, yeah, it's been great.
What has been one of your biggest challenges since having weight loss surgery?
Um, Honestly, I think that as time goes by, you start to sort of drift away from tracking your food. And I really and I started doing that. I started drifting away from tracking it, not so much measuring it, but tracking it in my app. And so now I've set an alarm in my phone to remind myself at the end of the day that, one, I need to take my medicine, and two, that I need to fill up my food tracking app. So the alarm on my phone has actually helped me, because I think that as time goes by, you start to kind of slip, and you don't really, remember to do it one day, and then all of a sudden a week goes by and you realize you didn't do it, and then a couple weeks go. So I think that's easy to lose that habit. So I set myself an alarm in my phone reminder to make sure that I do this. So it was a challenge for a little while to remember, and then I just had to adjust. So I made that adjustment to set the alarm, remind myself mentally, "Hey, do this. This is good for you."
Yeah. Yeah. I really encourage people to have at least a solid season of measuring and tracking in this
Uh,
journey. When you're building that new course, sort of that new plan, that new journey. And I don't think, not necessarily everyone has to track. Some people that are like real, all of my most successful people, almost all of them track on a fairly regular basis, even still. But even then, I think if you just track, I tell people, like, when it's long term, like years out later, if you just track like 1 or 2 days a month, You're going to keep that skill sharp. You're going to keep recalibrating, what the things that you're doing regularly. And also, the only thing I can guarantee in this journey is that at some point, both you and I are going to get off track. And if it's only been a few months since you've measured and tracked your food, so much easier to make that course correction to get back on track than if it's been years. And years will go by like so fast. It's crazy.
Yes, time flies really
Yeah.
fast. Yeah, before you know it, it's been a month and 2 months and 3 months. So yeah, but tracking is actually nice because I love to see my percentages. I love to see what my percentage of protein is to my carbs, to my sugars, to my fat. So seeing those, especially at the beginning, I'm like, I loved it. I thought it was fantastic. I'm like, did I really only get 60 grams of protein? How is that possible? I ate so much food, that's what your brain is telling you, like, God, I ate so much. I ate all day, and you're like, how did I not get enough? So it was funny to see that. But after a while, when you have, worked on that nutrition, that diet for so long, now you're into good habits, right? So now you're into those good habits and you know what to eat, what not to eat, how much to eat. So I started forgetting to do the tracking thing, but now that I've set the alarm, I can see it again. It's nice. I'm like, how did I only eat 70 grams of prep? I feel like I ate all freaking day, every day. Like, and so like you don't realize that, that, hey, I need to, down a protein drink real quick. Like, I need to get some more protein in me. So, but yeah, it's nice. The tracking thing is fantastic. So I definitely recommend anyone, at least when you're starting to do that, because being able to see those percentages and you don't realize how much carbs that you're eating or how much sugar you're intaking, until you start putting those numbers in. Yeah, definitely.
Yep. You don't know what you don't know.
Yes.
Yeah. Tracking can be such an eye-opening thing for a lot of folks. So definitely recommend it early
Yeah.
on. And then what you have experienced is very common. Like over time, there's just a little bit of behavioral shift, a little bit of slide. And then you don't have to track every day necessarily, but tracking every once in a while, it gives you that temperature check. That's like perfect. So that's great. I want to hear about biggest wins, biggest successes since surgery.
Biggest wins is really just health wise. I would say that's when we had discussed, the surgery. Remember, I said that the one thing that I wasn't so much concerned about the weight loss, but I just wanted to be healthy again, because I was at the point when I had started talking about surgery. I was pre-diabetic, I was high cholesterol, I was high blood pressure, I was on all of these meds for this, right? I think I took 5 meds at the time. I am no longer have high blood pressure. I'm not in the medicine for that. I don't have high cholesterol anymore. I'm not pre-diabetic. I'm literally off of all of my medicines now. I don't have to take any of them. I also work as an imaging tech at a medical clinic, so I can walk up and down those halls all day long for my whole 10-hour shift and still not feel tired by the time I'm done. You have absolutely no idea what it's like to walk around and your knees hurt and your ankles are swollen by the end of the day, your back hurts, you feel just like utter crap, right? To be able to come off that 10-hour shift and still feeling fantastic by the time I get home and still having energy, there's no bigger reward than that. Yeah.
Yeah. That's awesome.
Yeah.
Mel, we were really proud of you. You've done fantastic.
Thanks.
Really
Yeah.
cool. Yeah.
Yeah.
Weight loss surgery is a tool, and you got to have the right skills to use the tool. You got to be paying attention. You got to want to, use it. And you've done a fantastic job with that
It's
tool.
definitely a mental game. And to anybody that's even thinking about it, just have a super good support system in your surgical team and at home. It's just so crucial because it really is a mental game.
Along that lines, kind of my last question. Mel, do you have any regrets from having weight loss surgery?
Absolutely not. Not at all. And anybody that asks me, I tell them outright, I don't care. I'm not in the least stigmatized by it, if that's even a word. Like, I will tell anyone and everyone, I'm like, yeah, I had surgery and it's been fantastic and I highly recommend it. So no, definitely 100% no regrets. I would do
Yeah.
it all over again.
Yeah.
Yeah.
What about those people out there that have tried a GLP-1 like you and just like saw, kind of some, a small step in the right direction, but they're honestly they're feeling pretty hopeless right now.
Yeah, it's I was kind of the same way. I would see you see all the celebrities who endorse these and they've lost, 150 pounds or whatever, and then you're sitting here and you've taken it for a year and you've lost 20 pounds and you think, what's wrong with me? Why isn't this working for me? I don't understand. Even with, changes in diet and even with changes in, exercise, and it's not working, you feel defeated. You feel like, what's wrong with me? Why isn't this working for me? And it might be just a matter of, maybe you just need that little extra help. Maybe surgery is the thing that you need to kind of kickstart that off for you, kickstart your body, kickstart
Hardware
your mind.
upgrade. Yeah.
Exactly. Yeah. Yeah.
Sorry, I didn't mean to interrupt you. You're doing great.
Oh, yeah, that was great. Yeah. So yeah, that's how I feel. I would say that, like, I was a little apprehensive about it at first, but I would definitely do it all over again. It made all the difference in the world. The difference in just in physically and mentally, just being on the GLP-1 at max dose and after surgery and having surgery, two completely different things. Yeah.
Well, amazing. Mel, thank you so much for joining us. It was awesome to have you on here. We're all super proud of you at Eviva. If you are out there and you're struggling, we have a lot of tools, and just reach out. EvivaMD.com will be down. Description will be down below. And yeah, we would love to help you like we've helped thousands of people. So guys, I'll hit the stop button here. And then if we just want to hang on real fast and let the finish upload and do our debrief, and then awesome.
Yeah.
Well, thank you everyone for tuning in.
No,